Hi, I will be the nurse providing discharge teaching for my patient today. Just as a background, this is LW. This is a 74-year-old male who initially came into the ED on February the 23rd after having a transurethral resection of the prostate and came into the ED with gross hematuria, retention of urine due to clot formation. The patient needed to go into the OR for surgical clot excision and then was discharged home. The patient then returned to the ED on February the 27th due to feeling heart palpitations and was stating that he was in AFib. The patient had previously stopped taking his prescribed metoprolol and began feeling weak with heart palpitations and progressive hematuria. The patient was put on telemetry and was found to be in atrial fibrillation with a heart rate of 180 beats per minute. Patient denied chest pain, no syncope, and no presyncope. And his admitting diagnoses were atrial fibrillation and anemia. He has a past medical history of paroxysmal AFib, hypertension, hyperlipidemia, coronary artery disease, recurrent hypokalemia, benign prostatic hyperplasia, anemia, and he has a surgical history of a CABG performed in 2014 and then a transurethral resection of the prostate for BPH on February the 23rd of this year. So I wanted to explain my patient's diagnoses to him. So my patient is diagnosed with atrial fibrillation, and atrial fibrillation is a heart condition which is caused by rapid and disorganized electrical activity in the upper chambers of the heart. The heart is composed of 4 chambers. The upper parts are called the atria and the lower parts are called the ventricles. And our heartbeat and rate is controlled by electricity, which is also generated from within the heart from a location called the SA node. When the SA node is affected by something, it can cause the heart to beat irregularly. This is called an arrhythmia. Atrial fibrillation causes rapid and disorganized beating of the heart, which can cause you to feel heart palpitations or fluttering in your chest. As I said before, the heart is composed of 4 different chambers, and they all contract at different times, and they relax at different times. And this is done to propel blood out of the heart and to the body. When the chambers of the heart relax, it allows blood to fill the chambers. And during atrial fibrillation, when the heart is contracting rapidly over and over and over again, it decreases the amount of time that the heart has to fill back up with blood again. And since there is a decreased amount of blood being pumped out of your heart to your bodies, this causes symptoms such as fatigue and malaise, so feeling really tired and having excessive fatigue when completing activities, and then once again feeling the fluttering in the heart palpitations. Atrial fibrillation also causes a risk of developing blood clots. Because the heart isn't as effective as pumping blood out of it, it can lead to blood pooling within the heart itself. And when the blood pools inside the heart, it can clot. And these clots can then be pumped out of the heart into the rest of the body. So these clots can then travel to other parts of the body, such as the lungs and the brain. And then when this occurs, it becomes a medical emergency because these clots will then lodge in these areas, either the lung. When it lodges in the lungs, it's called a pulmonary embolism, and then it can lodge in the brain, and that is a stroke or a cerebral vascular accident. And when this occurs, it cuts off oxygen supply to these areas, and then so that is a medical emergency. You're also experiencing anemia, which is basically when your body doesn't have enough red blood cells. These are the types of cells that make up your blood, and red blood cells are the ones responsible for carrying oxygen and nutrients to all the tissues in your body. There are different types of anemias as well. You are diagnosed with an anemia called iron deficiency anemia, which means that your body is lacking in a mineral called iron, which is used by your body to make red blood cells. Iron in the body is used to make hemoglobin specifically, which is a part of the red blood cell that is responsible for carrying oxygen. And when you don't have enough red blood cells to transport oxygen, it can cause you to feel fatigued easier, it can cause cold hands and feet, bruising, and it can cause a rapid heart rate as well, because your heart is trying to compensate for the blood's decreased ability to transport oxygen to these areas. So it means that it needs to work harder to bring oxygen to these areas because the blood has a reduced capacity to carry oxygen. So the reason why this is all happening, the anemia and the atrial fibrillation are related to each other. So anemia causes the heart to beat faster and work harder because it's trying to compensate for your body's decreased ability to carry oxygen to the rest of the body. For some, this rapid heart rate can then lead to arrhythmias. Arrhythmias, once again, are the disruption of the heart's regular rate and rhythm. So when your heart is beating, it beats at a normal rhythm. But then when something external affects it, such as anemia, it can cause it to be irregular, and this can cause atrial fibrillation. And so for some, this rapid heart rate then can lead to arrhythmias, and this can cause atrial fibrillation. You have been discharged with a number of medications that you are meant to take. So these medications are aimed at managing your past diagnoses, but also managing your atrial fibrillation and your anemia. And this is the goal of regulating your heart rate, regulating your heart rhythm, preventing blood clots, and correcting your iron deficiency. So the first medication I'm going to be talking about is a medication called Eliquis. Eliquis is a type of medication called an anticoagulant, and this was prescribed to you to prevent the formation of blood clots. Like I said, since atrial fibrillation can increase your risk of developing blood clots, Eliquis will decrease this risk by decreasing the development of clots, by interrupting the different factors in our blood that form blood clots. You have been instructed to take this medication as a dose of 5 milligrams twice a day. You may take one dose in the morning, preferably at the same time, and one dose in the evening, once again at the same time. You may take it alone or with food, but if you do miss a dose, you need to take the missed dose as soon as you remember it on the same day, but to not double up on missed doses. And you should know that it is not recommended to take Eliquis with other anticoagulant medications or medications that have an anticoagulant effect on the body. So an example of this is aspirin. Aspirin reduces the body's ability to clot. And so when you combine that with a drug like Eliquis that has anticoagulant properties, it can increase the risk of developing bleeding and abnormal bleeding. This is the same for over-the-counter medications such as ibuprofen as well. While taking this medication, you should also refrain from taking St. John's wort, because it can decrease the levels of Eliquis in the blood and increase the risk of forming blood clots because it reduces its effectiveness. While taking this medication, you need to be aware of any abnormal bleeding, bruising. Specifically, keep an eye out for any pink or brown urine, red or black bowel movements, vomiting blood, frequent nosebleeds, and you should notify your doctor if you are experiencing any of these abnormal bleedings. And you should call your doctor if you have sustained a head injury as well, so you can any injuries, and specifically head injuries, so you can rule out any internal bleeding. You've also been prescribed a medication called metoprolol, and metoprolol is a medication called a beta blocker, and this medication is used for management of hypertension and atrial fibrillation. And this medication works by blocking some of the receptor sites that we have on our heart to lower your blood pressure and heart rate. So you are being prescribed 75 milligrams of metoprolol per day. You need to take this medication at the same time every day. Even if you're feeling well, it is really important to not skip doses of this medication. To not skip and to not double up on doses. If you happen to miss a dose, you need to take it as soon as you remember it, up to at least 8 hours at the latest before your next dose is available to you. It is recommended that you do not abruptly stop this medication because it can cause your heart rate and rhythm to become disrupted again, and that can be life-threatening. When you are taking this medication, it is important that before you take this medication that you check your pulse. And you can check your pulse in a number of ways. You can do it here on your hand just below your thumb. This is called the radial artery. And once you find what feels like a heartbeat, you can count the beats for a minute and record that. The goal normal heart rate is 60 to 100 beats per minute. And while you're taking this medication, it's just important to make sure that your heart rate isn't too low when you take this medication. So anything under 60 beats per minute. It's important that you take your blood pressure on a bi-weekly basis while taking this medication, just to make sure that your blood pressure isn't dipping too low. So this means a normal blood pressure would be anything like 120 over 80 and under is a normal blood pressure. You need to be careful when changing positions on this medication. Just make sure you're not standing up too fast, because when you take this medication, it can cause you to feel very dizzy when you stand up too fast. And this is called orthostatic hypotension. And that basically just means if you stand up too fast, you get really dizzy and you might faint or hurt yourself. So it's important to change positions slowly, to get up, sit for a minute, let your feet dangle off the bed, and then stand up. You need to notify your healthcare provider if you experience any abnormally slow pulses. So this is anything under 60 beats per minute. If you experience any abnormal slow breathing, if you have abnormally cold hands and feet, confusion, lightheadedness, rash, fever, sore throat, and you can take metoprolol with or without food. The next medication I want to talk about is ferrous sulfate. So ferrous sulfate is an iron supplement, and this is used to treat your anemia by replacing the deficient iron levels in your body. Iron is a mineral used by the body to make red blood cells, and it's a primary component of hemoglobin, which is a part of your red blood cells, and that's responsible for carrying oxygen. Your dose that you've been prescribed is 350 milligrams a day, which is divided into 2 doses a day. This is taken as needed, and no, that's not taken as needed. Your dose is 350 milligrams a day, which is divided into 2 doses. So you'll take 175 milligrams in the morning and 175 milligrams at night. This medication is most effectively absorbed either taken 1 hour before eating or 2 hours after eating. And to take this medication with a full glass of water or juice. You can take this medication with orange juice or any kind of juice with high vitamin C. You can eat an orange with this medication, and that's recommended because vitamin C will increase the absorption of this medication. It's instructed to take take the dose as soon as you remember within 12 hours of the next dose. Otherwise, return to a normal dose regimen. Some side effects of this medication: your bowel movements may become black. So that is normal, but then also consider when you're taking your Eliquis to monitor closely for bleeding, because both of those can cause black stools in one way or another. You should also follow a diet that's high in iron. So this means foods that contain dark leafy greens, red meats, organ meats, legumes, wholemeal pasta and bread, dried fruits such as dates. And this medication may cause nausea on an empty stomach, so it is maybe recommended to maybe wait 2 hours after eating a meal to take it rather than take it on an empty stomach, just because it can cause nausea and vomiting if on an empty stomach. And this medication may cause constipation as well. The next medication is amiodarone. So amiodarone is a medication called an antiarrhythmic, which is a type of medication used to correct arrhythmias, which is what we talked about, is the disruption in the heart's normal rate and rhythm. So you've been prescribed a dose of 180 milligrams a day. You can take this medication with or without food. If a dose is missed, it is instructed that you do not take it at all, and to call your healthcare provider if you miss more than 2 doses. Refrain from drinking grapefruit juice with this medication because it will increase side effects while taking amiodarone. You need to monitor your pulse daily while taking this medication, just like metoprolol, and you can take it in the same way. And you need to report any abnormalities in your pulse to your primary care provider. This medication has a side effect called photosensitivity. So this means that this medication makes your skin extra sensitive to the sun. So you've been instructed to wear protective clothing and sunscreen while taking this medication due to these photosensitivity reactions that can occur. You've been instructed to call your healthcare provider if you experience any swelling of the scrotum while on this medication. This medication does have a side effect where it can cause swelling and pain in the scrotum. Another side effect is a bluish tinge to the skin or face. This is a non-harmful side effect. You do not need to call your healthcare provider if you've experienced this. And this medication does increase your risk of a low heart rate when you take it with your metoprolol. So it's important that you do closely monitor your pulse daily to make sure that your heart rate isn't dipping too low. And then finally, to avoid taking St. John's wort with this medication because it can decrease its effectiveness. In the last medication, you've been prescribed acetaminophen. Take as needed for pain. Acetaminophen is a non-opioid analgesic, and it works by preventing the action of pain mediators in our body called prostaglandins, and it decreases the action of them on our nervous system, how we feel pain. You've been prescribed to take 325 milligrams every 6 hours as needed for pain. It is important that you do not exceed taking more, like 2,000 milligrams or more a day in a 24-hour period, because then there's a risk of overdose. This medication can be extremely hard on your liver and very damaging, so it's important to remain within that prescribed dose range. It is not encouraged to drink alcohol while taking acetaminophen because of how alcohol and acetaminophen both impact the liver. They are both very hard and damaging to the liver, and long-term use of acetaminophen can increase your risk of developing liver complications. But you can take Tylenol on an empty stomach. So your healthcare provider has indicated that you can continue activity as tolerated. So this means that any activity that you're able to tolerate without excessive fatigue. So don't start going to the gym all of a sudden when that wasn't something that you were doing before, especially if it makes you fatigued. You've been instructed to monitor your pulse daily to make sure that you are within the normal range of 60 to 100 beats per minute. Anything over 100 is considered a rapid heart rate called tachycardia, and anything below 60 is considered a very low heart rate called bradycardia. you've been placed on a special diet called a 2-gram reduced sodium diet. And this means that your sodium intake for the day has been limited to a little bit less than a teaspoon of salt. 2 grams is just a little bit less than a teaspoon allowed per day. And this is done because excessive salt intake promotes high blood pressure, and excessive salt intake causes you to retain fluids. And when you retain more fluids, it adds more workload onto your heart to pump blood against your high blood pressure. You've also been placed on a low cholesterol and low fat diet. And this means to avoid foods high in fat and cholesterol, and this consists of full fat milk products, oils, any processed packaged food items. A lot of these processed packaged food items also are high in sodium as well. Fatty cuts of meat, fried foods, foods like that are high in fat and cholesterol, so you've been instructed to avoid those while also reducing sodium intake. It's also important to note that there is a lot of hidden sodium in some things, such as pickles are high in sodium. Carbonated soft drinks, such as soda, are high in sodium. So you've been instructed to reduce your sodium. And your doctor has instructed that you self-monitor for signs and symptoms of atrial fibrillation, and these consist of, irregular heartbeat, lightheadedness, the fluttering in your chest, extreme fatigue, shortness of breath, chest pain, and you're instructed to call your healthcare provider when you're experiencing these symptoms of fatigue and lightheadedness. But for symptoms such as shortness of breath, chest pain, and irregular heart rate, you've been instructed to come to the ED when those symptoms arise, because they can be related to atrial fibrillation or an arrhythmia. You've been instructed to call your healthcare provider for your anemia if you are experiencing severe fatigue. So just to make sure that our patients know exactly what they need to know for their discharge instructions, we like to have our patients do a kind of teach back. So can you tell me about your treatment plan and your discharge instructions so that I know that you know it? Sure, I can do a little teach back. So I guess I'll start with my Eliquis. This is my medication I'm taking to prevent my blood clots, because my AFib can cause blood clots. I'm supposed to take it twice a day, once in the morning, once in the evening. I gotta take it at the same time. I can take it with or without food. If I miss a dose, I need to take that dose as soon as I remember it on the same day, but I can't double up on my missed doses. I need to make sure I'm not taking my Eliquis with any other medications that can make me bleed, like aspirin. And I can't take medication with any grapefruit juice or St. John's wort, or else it won't work no more. I need to make sure I'm not bleeding any. And I need to call my doctor if I have any abnormal bleeding. Then for my metoprolol, which I'm taking for my high blood pressure and my AFib, I'm going to take it at the same time every single day, even if I'm feeling good. I can't skip a dose. And if I do skip a dose, I got to take it up to 8 hours before the next one. And I can't stop the medication all of a sudden, because it'll make my heart go back into AFib again. I need to make sure while I'm taking this medication that I check my pulse and make sure it's not getting too low. And I got to take my blood pressure on a bi-weekly basis. And then I need to be careful while taking this medication that I don't get up too fast, or else I'm going to pass out. I got to change positions slowly. And I got to call my healthcare provider if I have any slow pulse, any slow breathing, rash, fever, sore throat. Now for my iron supplement, This is for my anemia. I'm taking this medication 2 doses, 1 in the morning, 1 at night. And I can either take it an hour before eating or 2 hours after eating with the orange juice so it'll absorb better. And I need to watch out for my bowel movements because they might turn black. And I need to follow a high iron diet. So dark leafy greens, red meats, organ meats to help my anemia. Then for my amiodarone, this is the medication for my heart rhythm. I can take it with or without food. And if I miss a dose, I don't take it at all. And I need to call my doctor if I miss more than 2 doses. I can't drink any grapefruit juice. And just like the other one, I need to monitor my pulse and blood pressure to make sure it's not going too low. And to make sure it's not getting all wonky. I apparently got to put sunscreen on and sunglasses so my skin don't burn up. And for my acetaminophen or Tylenol, I can take it as needed for pain, 325 milligrams every 6 hours, but I can't take more than 2,000. And I need to make sure I'm not drinking anything while I'm taking it because it can mess up my liver. I can go back to normal activities as long as they don't make me fatigued. I need to monitor my pulse, make sure it's not getting too low, below 60 is what the nurse just told me, or above 100. And I need to monitor my blood pressure. And I need to keep an eye out for that fluttering in my chest. Keep an eye out for fatigue, shortness of breath, chest pain. And I'm on a new diet now, so I can't have more than a little less than a teaspoon of salt every day because of my blood pressure. And I'm on a low cholesterol, low fat diet. So that means I gotta ask the wife to put the butter away and the oil and the fried chicken away and start eating healthier. And I think that's about it.